Hi, this is Kelly Oneill's video submission for the second assessment. This is my standardized patient. It's my mom, Karen. So thank you so much, Karen, for agreeing to participate in this, and we will get started. All right, so prior to the exam, I cleansed my hands with soap and water, donned a fresh set of gloves. We both have on eyewear and masks. For our first exam, we're going to assess the abdomen. In the clinical setting, the patient would have on less clothes than this, but we're just going to work with this for now. My first step would be to inspect the abdomen. I would lift up the shirt and look for color, contour, and symmetry. Then I would ask the patient to lay back on the exam table. And in the supine position, I would again assess for color, contour, and symmetry, paying special attention to the umbilicus for any evidence of hernia, and I would also be looking for pulsations. Once I was done with the inspection, I would move on to auscultation, which is a different step than we're typically used to. But we auscultate before we start pressing around. So with the diaphragm, I'm going to auscultate all four quadrants, listening for vowel sounds. And I will want to listen for at least 5 to 15 seconds per quadrant. And again, this would be skin to skin in the office. After I'm done auscultating for bowel sounds, I would then move on to auscultate for friction rubs over the liver and the spleen using the diaphragm, starting with the liver. And then the spleen. Next, I'm going to do auscultate the vascular system, listening for bruits. So I'll start with the diaphragm, and then I'll work my way back up using the bell. Beginning with the aorta, which is just above the umbilicus, slightly left of midline. Moving on to the renal. And the iliac. And the femoral. And the femoral. I'll switch to the bell and trace my steps back. From the femoral, the iliac, renal, and aorta. Now that the auscultation is done, I can move on to actually putting hands on the abdomen. And I will want to percuss all four quadrants, expecting to hear tympany. I'm not sure what the best way. All right. So just a quick strike of the wrist. After that, I'll move on to palpation. First, I'll start with light one-handed palpation, and I'll palpate all four quadrants, assessing for any tenderness, masses, And then I will move on to deeper palpation, two-handed technique. Again, feeling for tenderness. And while I'm here, I will assess the femoral pulse. Again, this would typically be skin to skin. And let's see, then I'm going to assess the liver. So I'll bring this hand underneath. And then with deep palpation, take a deep breath in. I'm assessing the liver for size and consistency. You can relax. I do the same thing with the spleen underneath. Relax down. Take a deep breath in. Okay, and relax. And assessing for size and consistency as well. I'd also want to palpate the aorta. Okay, take a deep breath in and relax. Great. And I would expect that to be between 2.5 and 3 centimeters. Once I have done those palpations, I do want to also palpate the inguinal lymph nodes, this chain down here. I'll do that on both sides. All right. And that concludes the abdominal assessment, and then we'll move on to the musculoskeletal. All right, moving on to the musculoskeletal, my first step would be to inspect. So I just want to inspect from a distance, size, shape, look for any obvious deformities, masses, areas of erythema or swelling. And then I'll move on to a focused assessment. So if you wouldn't mind, I'm going to first kind of get in here, and my first assessment will be the, I always mess up this name, Temporomandibular Joint, which is just anterior to the tragus. So I'm going to find the little indentation here, palpate it for warmth or any tenderness. I'm going to ask you to clench your jaw and then unclench. Ask you to open and close your mouth. Thank you. And then move your jaw side to side. And then jut your chin out and back in. Terrific. All right, then if I can have you stand up. I'm going to turn you this way. Next, I'm going to assess your C-spine. First, do just an inspection. Look for any kyphosis, any sort of deformities, areas of erythema. Then I'll palpate. This would again be skin to skin. And I'll be noting areas of tenderness or warmth. And now we'll do the range of motion for the C-spine. So if I could have you flex forward and touch your toes, and then that's perfect. And then extend back, 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 and then hyperextend back. Perfect. And then I'm going to have you do a lateral side bend, side to side. And then while I stabilize your hips, I'm going to have you rotate your trunk, your upper body, rotate and rotate. All right, so that's fluid movement. Then I'm going to also do the same thing with your cervical area. So if you could tuck your chin to your chest, flex forward, extend back. Great. And then lateral ear to shoulder and other side. And then rotate your head side to side. Kind of like just side, like just turn your head side to side. There you go. Perfect. All right. So you can have a seat. Next thing we'll do is your shoulder. So I want to inspect it anteriorly and posteriorly. Want to look at the scapula for placement. I'd be looking for any masses or erythema. And I'll palpate it, starting at the sternum and moving over to the clavicle. I'll palpate the AV joint, assessing for warmth or tenderness. Move on to the humerus and the bicep groove. Any tenderness noted?
No.
No? Okay. And I would do this for both sides. So now we're going to do range of motion for your shoulders. So first thing I'm going to do is have you flex forward all the way up and then all the way back down and kick your arms back out. Terrific. All right, so that was nice fluid motion. Next thing I'm going to do is have you abduct out, and then adduct back in. Terrific. All right. And then we're going to do an internal and an external rotation. All right, so the external rotation is like this. Try and touch your shoulder blades. And then the internal brings it around back up like this. Internal. Terrific. All right, so moving on to the elbow, I will first inspect, again, looking for any deformities or swelling, and then I'll palpate, looking for warmth or tenderness. So what I'd be inspecting here, again, I do this on both sides, would be the olecranon process and the olecranon bursa. And for range of motion, I'm just going to ask you to flex and extend. Great. And then twist your arms up. So that would be supination, and then back down. That would be pronation. Perfect. All right, so moving on to your wrist and your hands. I would do this for both sides. First thing I would do with inspection, I'd look for any arthritic changes, any skin discoloration, any areas of erythema or swelling. And then I palpate your entire wrist and hand, paying attention to the joints and the joint capsules. Okay. And then for range of motion, I'm going to ask you to put your hands out like this, and then flex them down, and then back up, and down, and back up. And then I'm going to ask you to spread your fingers apart. That's abduction, and bring them back together, and that's adduction. And I'm going to ask you to do a radial and ulnar deviation. So in for radial, keep your arms kind of straight and just do the wrists, just wrists. And then out for ulnar. Perfect. And then we'll do the same thing with your fingers. So if you could just flex your fingers down and then flex them back up. Terrific. All right, so now moving on to the hip. All right, so moving on to the hip, I'm just going to have you extend your leg back. Perfect. All right. You all right? Mm-hmm. Okay. All right, then you can go ahead and lay back down on the exam table. So before we get into the range of motion, I would pull the clothing down and I would inspect the hip. Again, for any deformities, I look for any shortening of the leg, any discoloration. So I am going to flex your leg all the way up, bend your knee, up, terrific, and back down. Listening for crepitus or any signs of discomfort. And then I'm going to internally rotate and then externally rotate. Terrific. Okay, you can sit up. All right, so moving on to the knee. First I'm going to inspect for any signs of swelling or erythema. Then I'm going to palpate. I'm going to palpate the patella and the patellar pouch. And then also the tibia. Looking for deformities or erythema. I'm going to have you extend your knee on and then flex it back. And then if you can move your foot in and out, that's internal and external rotation, range of motion. All right, moving on to the ankle and the foot. I'll first inspect, again, for deformities, nodules, erythema. And then I'm going to palpate. So I'll palpate the Achilles tendon. I'll palpate the heel. I'll palpate the plantar fascia. I'll palpate all the toes, the dorsal part of the toe and the plantar part of the toe. And I'll palpate the ankles, checking for tenderness or for warmth. And then for the range of motion, you could just kind of let your foot dangle, point your toe, that's the plantar, and then flip it up, that's the dorsal, and then we'll do eversion and inversion. So you can just kind of twist it, and then that way. All right, great. All right, so if there was a need for some of the special tests, such as the drawer test for the ACL, I would conduct those at that time. But for time purposes, we'll move on to the neuro exam. And we already covered the cranial nerves during the Heat exam. But if we didn't cover them, we would have done them at this time. But we will start with the neuro exam with inspection. So first thing I'll do is just inspect from a distance. I'm looking at your muscle bulk. I'll be looking for any signs of atrophy or hypertrophy. Just wanting to get an overall idea of contour of the muscles, size, and shape. And I don't note any abnormalities. Moving on to tone, we're going to assess for resistance to passive range of motion. So I would do this on both sides. So I'm going to take your arm and just let me bend. Bend. Great. So I'd be assessing for spasticity or decreased resistance, which I do not see. Okay, next we're going to assess for muscle strength. So I'm going to ask you to try and resist my hand. And here, terrific. All right, and your shoulders, great. Put your arms up like this and push against my arms and then pull against my arms, pull to you, great. All right, and then cluck like a chicken, great. All right, grip my fingers and pull, terrific. All right, try and press up. Okay, press against and against, pull back. All right, try and push your foot up against and down, terrific. All right, so I would grade those all as a 5+. Next, we're going to work on coordination. So I'm going to ask you to follow me with your hands. Great. All right, so then I'm going to ask you to touch my finger and then touch your nose. My finger, your nose, my finger, your nose. All right, I'm going to ask you to stand up. I'm going to inspect your gait, so if you could just walk for me. Terrific. And then come back and do heel to toe. Heel to toe, heel to toe, heel to toe. Woo! I know it's a hard one. I'm going to ask you to spin around. And then if you can try and walk on your heels. And then walk on your tippy toes. Terrific. All right, you did great. Help you back to your seat. Thank you. Okay, so moving on to deep tendon reflexes. We'll start with the tricep. So just loosey-goosey for me. I would do this on both sides. There we go. All right. Moving on to the bicep. Loosey-goosey. Terrific. Moving on to the brachioradial. Loosey-goosey. There you go. Great. I'll move on to the patella. Find my landmark. Terrific. Move on to the Achilles, and I'll flex the foot forward a little bit. Great. And then the plantar. Great. Thank you, ticklish. And I would grade those as a +2. All right, so moving on to the sensory function. Our first test will be light touch and pain. So let me know, close your eyes. Tell me if you feel light touch or pain.
Light touch. Pain.
I guess it's soft touch and light pain.
Light pain.
I confused you.
Soft touch. Light pain. Soft touch. Light pain. Light pain.
Terrific. All right, so next we will do point localization. With your eyes closed, I'm going to touch an area of your body, and then I want you to open your eyes and point to where I touched, okay?
Mm-hmm.
Open your eyes. Terrific. Close your eyes. Terrific. One last one. Great. All right. So moving on to proprioception. I'm going to deviate your great toe, and I'm going to point it up or down. And with your eyes closed, I want you to tell me if I'm pointing it up or down. Let me. Okay. Are you ready?
Mm-hmm. Up, down. Up, down.
Correct. That's great. But you know what? I think I need to keep it there. All right. So we're going to move on to vibration. I'm going to ask you to close your eyes. I'm going to put a tuning fork to your great toe. When you feel the vibration, I want you to let me know. And when you feel the vibration removed, I want you to let me know as well. Tell me when you feel it. Tell me when you feel like it's gone away.
Okay.
So if you can extend your foot up a little bit. Great.
I feel it. You took it away.
Terrific. All right, so with your eyes closed, I'm going to put an object in your hand and ask you to identify it. And this is stereognosis.
A pen.
A pen. Terrific. And then our last exam, I'm going to draw a number in your hand and I want you to tell me what number it is. And this is graphesthesia.
3.
Terrific. So that concludes our exam of the abdomen, musculoskeletal, and the neuro exam. And again, if I had any concerns for the need for special tests, I would conduct them. But in the essence of time, I will save those for another time. Thank you so much for viewing the video. And again, thank you to my mom for being my standardized patient.
Welcome.